Hi, today we are going to discuss about blood culture. I am Jhansi, tutor, working at M College of Nursing. Now let's see what are the objectives. At the end of the session, the listeners will be able to define blood culture, how to collect the blood, proper filling method, articles and methods of collection, and how to do a good sample collection. Definition. A blood culture is a laboratory test in which blood is taken from the patient, is being inoculated into bottles containing culture media to determine whether infection causing organisms are present in the patient's bloodstream. Blood cultures. Confirming the presence of microorganisms in the bloodstream, identify the microbial etiology of the bloodstream infection, helps determine the source of infection, provide an organism for susceptibility testing and optimization of antimicrobial therapy. So these are the blood culture bottles. Okay, a proper filling method. How a proper filling method should be. Optimal adult fill volume for bottles is equal to 10 ml per bottle. And you can see a line here with a white hash mark on the black edge of the strip. So there is the correct amount where we are supposed to fill. Don't underfill or don't overfill the bottle. This is the correct volume where you are supposed to fill. It's already a preset vacuum pressure in the bottle, so we have to put the blood only where the line is being drawn. Hold it up straight. So this is the proper filling method. When to collect? Blood culture should be collected as soon as possible after the onset of clinical symptoms, ideally prior to the administration of antimicrobial therapy. Okay, what are the articles required? Tourniquet, 70% alcohol swab, chlorhexidine, aerobic and anaerobic bottle, blood culture bottles, syringe 20 cc, needle 18 gauge, a sterile tray, clean gloves, dressing pack and pen or labels to write over it. Prepare the culture bottles. So remove the cap and scrub the top of each blood culture bottle with a separate alcohol swab for 30 seconds. Allow it to dry. Don't fan or blow on top once scrubbed. Do not touch tops once scrubbed. Patient preparation. So you will explain the procedure to the patient, perform the hand hygiene, place the tourniquet. Tourniquet should not remain on the patient for longer than a minute, and palpate and select site prior to cleansing the skin and remove the tourniquet. Method of collection. Prepare blood collection kit, perform hand hygiene and put on clean gloves. Place tourniquet, cleanse skin with 2% chlorhexidine with 70% isopropyl alcohol applicator for 30 seconds using back and forth scrubbing technique. Allow to dry for at least 30 seconds. Don't fan or blow on skin once cleansed and don't palpate site. Perform venipuncture. Fill the aerobic bottle first and then the anaerobic bottles. Fill until 10 ml is obtained in each bottle. Remove the tourniquet and hold the pressure. Place the dressing on above and remove the gloves and perform hand hygiene. Label cultures with bedside labeling device. Sent to the lab as per the hospital's policy. What is good sample collection? Prior to use, examine the bottles. Check the expiry date printed on each bottle. Strictly follow the collection protocol. Blood culture bottles should be clear and correctly labeled. Each blood culture set should include an aerobic and anaerobic bottle. Blood for culture should be drawn from veins, not arteries. It is recommended to avoid drawing blood from a venous or arterial catheter. Carefully disinfect the skin, transport the inoculated bottles and document the same. Hope it's clear. These are some of the references. Thank you.